We can end cervical cancer. Assalamu alaikum and very good afternoon to all of you. I'm Dr. Asya Nabi, General Practitioner and Assistant Medical Director at Prime Healthcare. Today, we are here to highlight the issues related to cervical cancer, HPV disease, or human papillomavirus disease, and the importance of early detection. So, a lot of information from our today's guests and speakers on this webinar today. Let us know, get informed, find out the fact about cervical cancer, help educate other women in your life too. Get screened, get vaccinated. By the way, do you know more than 95% of cervical cancer is due to the human papillomavirus, also known as HPV virus. With this, I would like now to present my first speaker on this webinar today. We have a very passionate doctor, Dr. Varsha Oja. She has over 22 years of experience in the field of obs and gynae. She has a multiple affiliation internationally. She manages all gynecological cases. For example, normal and high-risk pregnancies, normal and cesarean deliveries, contraception, hormonal imbalance, adolescent gynecology, menopause, gynecological problems such as fibroid, endometriosis, and the list is obviously unending. Doctor is joined from Prime Hospital, Karol.
Hi, Dr. Thank you so much, Dr. Asya. Thanks for inviting me.
Thank you. Now I have my another speaker on this webinar today. Dr. Hedi is a specialist in her field of obs and gynae. She believes a life spent helping others is a life filled with purpose. With 18 years of experience in the medical field and 13 years of expertise in treating women, she has acquired a wide range of knowledge and skills, have completed specialty training in obs and gynae at a tertiary government-owned institutions, several international organizations with which she is affiliated, expert in ultrasound, gynecological scanning, procedures, prenatal, postnatal, high-risk pregnancies, management of menstrual irregularities, and obviously the list is long, I cannot complete here. So I welcome both of my speakers. It's an honor as well when we are moderating such sessions, but equally it's very important topic as the cervical cancer cases are actually, if we see the statistics, the numbers are reducing, but the increase of awareness is still the requirement. I'll now start with Dr. Varsha. So if we talk about cervical cancer, doctor, so most of the women or men or, overall, people are not very familiar with cervical word. So if you can start with what is cervix or what is cervical, and then what is cervical cancer and why it's important to talk about it.
Sure. Dr. Asya, cervix, we can start with the basic anatomy of the uterus, that is the womb, which is the childbearing organ in females. The mouth of the uterus is called cervix. Cervix is the part of the uterus which is easily accessible to us. We are able to visualize the cervix when we do the internal pelvic examination, the vaginal examination for the females. That brings out the importance of the cervical cancers because it is one of the malignancies which can be screened. As we all know that not all the cancers can be screened. Screened means you are able to detect the disease in a precancerous stage when it has not actually happened. In females, we are able to do the screening for certain cancers and we are able to detect that this patient has high possibility of developing this cancer over a period of time, which might be in next 1 year, or it can take 15 to 20 years also to develop that cancer. So we can actually take care of these females and we can monitor them, we can follow up closely, we can do further investigations, and we can do some treatment to prevent the disease from, to prevent them from getting the disease in future. Now, why is cervical cancer important? Because as you rightly said, cervical cancer is actually worldwide the second most common cancer in females after breast cancer. Definitely, there is increased awareness, there is increased screening, the availability of vaccine, as we know, for the HPV virus. The disease is reducing in its potential, but still it's very high. The disease is so common, the precancerous changes are so common, we are seeing it so frequently in our day-to-day OPD clinics And now coming to the anatomy part of this cervix. Cervix, as I said, is the lowermost part of the womb, the part of this womb which we can see when we examine the patients vaginally. There are certain changes in the cervix which can be detected by the routine pap smears, and pap smear has to be done routinely for all the females to detect the cervical cancers, to detect the precancerous changes in the cervix, to detect any kind of abnormal changes in the cervix. And we can talk about the risk factors for cervical cancer, and we can go ahead with that.
Yeah,
And
I'll request now Dr. Hedy to probably, so overall for the audience or for everyone to know is the lower portion of the uterus is cervix. So we are talking about cervical cancer. So at least everyone can make it out that what is cervical cancer. So because sometimes people also make wrong things, like they think that cervical is the neck pain, and then cervical cancer they also relate to that verbally. So now I'll request Dr. Hedy, since we know cervical cancer, it's the second number cancer in the world for the women. What causes cervical cancer? If you can just put some notes on that.
Okay, so cervical cancer occurs when cervical cells become abnormal, and over time it grows out of control. So the long-lasting infection with certain types of, as you have said a while ago, human papillomavirus, which is the main cause of cervical cancer. And it is a common virus that is passed from one person to another person via transmitted during sexual intercourse. So the cancer cells may invade deeper into the cervical tissue, and in advanced cases, cancer cells can spread to other organs of the body. So at least half of sexually active women have HPV at some points, but not all HPV infected women can have cervical cancer. So there are certain risk factors. Shall I proceed with that, or?
Yes, please, doctor, please proceed.
Okay. Among all the cervical cancers, so HPV is the number one cause, but some other causes can cause that cervical cancer over time, and not all HPV. There are several strains of HPV. Okay, there are the low risk and high risk. So not all HPV infected women may have cervical cancers. So other may have genital or skin warts. Okay, so it is the most common. People get it in their lives, but it may not cause symptoms. So you will not know that you have it. So it's really important to have screening. Okay, so sometimes HPV will go away on its own, but others, there's a chance of causing cervical cancer. So other risk factors may be HIV, which lowers the immune system, and smoking as well, which may also weaken the immune system. But other research said that the substances of the tobacco or smoking itself damages the DNA of the cervix, which might cause cervical cancer in the future.
Thank you, doctor. So, if I just want to ask that multiple marriages or multiple partners can also be the risk factor for cervical cancer. It will increase.
Early sexual intercourse and multiple partners as well may cause cervical cancer.
And is there any risk factor for smoking related to cervical cancer as well?
Yes, I've said a while ago that smoking may not only weaken your immune system, but other research said that the content of the tobacco or smoking damages the DNA of the cervix cells. So it may contribute to the development of cervical cancer in the future.
Thank you, doctor. Dr. Varsha, I'd like to ask you, what are the signs and symptoms? Like, for example, we discussed about the lower part of the uterus is cervix. Now we know the risk factors also, that early marriages or multiple, partners.
Parity, increased parity. Even family history sometimes plays an important role in cervical cancer also. And
Okay, so for families, how they should find about it. So we talk a lot about breast cancer and other cancers. At least we are not familiar with, but I don't see, as a physician myself also, and I don't see much people talking about family history when it comes to cervical cancer. How do you want people to talk about it and to know their risk factors in the family? What is that message you would like to let people know?
see, one thing, Dr. Asia, I feel is that if anyone has any disease, you should not feel shy about it. You should not feel shy in talking about it. And you should convey it to all your close, nearby people and try to increase the awareness as much as possible. So, if you have a first degree relative with a family history of cervical cancer, it increases the risk of cervical cancer also. Although we know that the most common reason for cervical cancer nowadays, almost 99% of cervical cancers are related to the infection with the virus called human papilloma virus, which is a sexually transmitted disease. It's a sexually transmitted infection. And it brings out certain changes in the cervix. It brings out those abnormal cellular changes in the cervix, which can be detected by examinations, by clinical examinations. So now coming to the screening part of cervical cancer, Dr. Asia. Previously, the guidelines used to say that we should be doing the screening by pap smear alone. And as per the recommendations, the screening starts at the age of 25. The aim is that you start the screening when the females they become sexually active, and we usually recommend after 25 because before 25 the chances of infection is very high, but at the same time the body has more capacity to fight with that infection, and most of the times the infection goes away. So we should start the screening at the age of 25. From 25 till 49, it should be done every 3 years. And after the age of 49 till the age of 65, it should be done every 5 years. How do we screen for cervical cancer? Previously, it was only pap smears. But now, as per the latest guidelines, we should start with the HPV DNA analysis. The HPV DNA for the high risk type. Any female who is positive for the high risk HPV, we need to do the other investigations to find out whether she already has any abnormal cellular changes in the cervix or not. So there comes the role of pap smear. So after doing the HR-HPV, if it's positive for high risk, you follow up with the pap smear. Any abnormal changes in the pap smear, any borderline changes, low-grade lesions, high-grade lesions, depending upon the cellular changes which are diagnosed by the pathologists, we follow up with the colposcopies. If the pap smear is normal, then you need to repeat the high-risk HPV DNA status after 1 year. If the pap smear is abnormal, you will refer the patient to the colposcopy clinic, get the biopsies done, and to rule out any kind of abnormal cellular changes, any low-grade lesion, high-grade lesion, invasive cervical cancers, all that can be diagnosed with the biopsy and the colposcopy.
Right, Doctor. Dr. Haldi, I just want to ask you here, what are the signs women should look for, like in day-to-day activities? Like, what are the signs can make them suspicious of cervical cancer?
First and foremost, you have to observe for unusual vaginal discharge, which may contain blood and/or between your periods or after menopause, or pain during intercourse, or vaginal bleeding after sexual intercourse. Then other warning signs may be itching or burning sensations in the vagina, low back or abdominal pain, unexplained fatigue or unexplained weight loss, frequent and urgent urination, and abdominal bloating. Those are just signs not only for cervical cancer, but also for other signs of cancer.
Thank you, Doctor. Dr. Varsha, I want to ask, in your clinical practice, what is that a younger age you have found that a woman was or girl was suffering with cancer?
Honestly speaking, as per guidelines, we should start the screening at the age of 25. But we in Dubai, we are seeing so many cultures. We are seeing patients who are exposed. I mean, they have different cultural values. People have multiple sexual partners who are coming to our clinic, and they are infected with HR, HPV at a very early age. It can be as early as 21, 22 also. And we have honestly speaking, all of us probably must have seen, we have seen patients having high risk HPV also, and CIN2, CIN3 also in the pap smears and the biopsies. That's
Absolutely.
very
One of our patient has also mentioned must go through CIN1. So our audience
yeah.
is also quite active and informative.
uh, it's not that it goes through CIN 1, 2, and 3. There is no clear cut guidelines related to that. But yes, definitely, CIN 1 is a low grade lesion. CIN 1, if it's positive with HR, HPV, not necessarily you have to do the treatment for that. It can go on its own. I mean, the disease can have a different course. It can regress, it can stay, or it can progress. That depends upon having multiple sexual partners, the persistence of the viral infection. If the HRHPV persists, there is more chance that she will progress into the invasive cancer. Other thing is the load. The viral load is also very important. So the viral load is more in multiparous females, those who have multiple sexual partners, young age at which they have started the sexual intercourse. Condoms prevent against these infections. It prevents
Yeah,
against.
I wanted to come to that point, doctor. We talk about that, 25 to 49, we should do every 3 yearly. And but here we are talking about that people in high risk, like what Dr. Heldy already discussed, people in, high risk or any kind of signs and symptoms are there, they should probably check early. Though there's no age, at least limit, at least to start with 21, if you already have a marriage before 21 or so. So in just would like to know that, is there any way that we can prevent cervical cancer?
Of course,
Prevention.
uh, getting screening, cervical screening as early as possible, because it will take at least 3 to 7 years before you get to develop, before the cervical cells become abnormal or you can detect cervical cancer. So it's very important for early screening for us to detect early before they become cancer. So I would just like to add what Dr. Varsha has mentioned. Other guidelines says that it must be as early as 21 years old, right? So at 21 to 29, you can do pap smear alone, and that will be done every 3 years. That is if the results are normal, and more frequent if it's not normal. And if you are 30 to 65 years old, there are three options. So it may be a co-testing. We have the co-testing is a combination of pap smear and HPV testing every 5 years, or you can do the pap smear alone every 3 years. For those who are 30 to 65 years old, an HPV test, you have the option to discuss this with your doctor. You have the option of HPV test alone, or HPV test with pap smear, or every 3 years of pap smear alone.
Thank you, doctor. So the key is basically we say that, yeah. So the key is basically we say that even irrespective of the viral load or the viral infection, the early detection is actually the key, and it's like can range from many years. So the best part, anyone who's sexually active and have all the kind of risk factors what you already mentioned, you and Dr. Varsha, they should proceed themselves, and irrespective whether they need to visit to a gynecologist or not, they should make it a mandatory plan that I am responsible for my health and I need to see the doctor on this matter. So let us discuss, Dr. Varsha, about a 25-year-old girl. She feels that, okay, there is a recurrent urinary kind of infection. and she's not getting better with antibiotics. She's not getting better with basic treatment, which she has taken over the phone, probably because a lot of Google information is there. We have a lot of friends who suggest and all. Eventually one of the friends says that, okay, maybe you need to go to see a gynecologist and do a pap smear. So she's completely new about this idea. She don't know. So, and she's booking an appointment with Dr. Varsha. So what will she expect to happen in the clinic?
Okay. Yeah, whenever the patient comes to us, definitely if she's having recurrent urine infection, first thing is she will be treated for the urine infection. We'll do a urine sample, urine culture, everything. If the patient is sexually active, we will advise her to do the pap smear. Now, how do we do the pap smear? Dr. Asia, as I've already told, this is the part of the uterus. The cervix is the part of the uterus which we are able to visualize in our clinic when we are doing a vaginal examination. So for that, we have to put in a vaginal speculum per vaginally. When we put in the speculum, the patient needs to be comfortable. She has to be mentally prepared for that. She has to relax, because if she's relaxed, then it doesn't hurt. If she's not relaxed, sometimes the speculum can pinch, but when it is put in, after putting the speculum, we are able to visualize the cervix. We have a brush in our clinic. We take the brush, we rub it along the cervix, and then we dip it in a solution and we send it for the cytological examination. The same sample can be used for for testing for the HPV DNA also. If the patient has symptoms of vaginitis, vaginal discharges, she has history of multiple sexual partners, any signs and symptoms of pelvic inflammatory disease, she can do other sexually transmitted infection panel also.
So, Doctor, pelvic inflammatory disease, can you explain this? What are the symptoms of pelvic inflammatory disease? What women should know?
Disease is when there is an inflammation in the pelvis. Pelvis is the area around the uterus, which involves the uterus, the tubes, the ovaries, everything. And most of the times it is an ascending infection, which is transmitted through sexually transmitted infections. There are a lot of bacterial infections which are transmitted sexually, and HPV is also one of them. And when the inflammation goes into the pelvis, into the uterus and the surrounding structures, it can be associated with severe pain, pelvic pain, coital pain, pain while doing the pelvic examination, the vaginal examination, abnormal vaginal discharges, and menstrual pain. All these can be the signs and symptoms of PID. Also, the patient can present with abnormal intermenstrual bleeding, postcoital bleeding, coital pain, I already said. So, this is what you expect from pelvic inflammatory disease. And the patient, and after doing that pap smear and the HPV DNA analysis, if she agrees to, the results will be there in about a week's time. The HPV DNA, the high risk HPV DNA analysis might take 10 days also. The patient should always follow back for the results so that the results are not missed upon. In case there is any abnormality, or what do we expect out of the result? Either it can be normal or it can be abnormal.
So, doctor, here I want to ask, so to pap smear altogether, booking an appointment will take less than 2 to 3 minutes altogether, right?
That will take, yes.
So that is what I wanted to tell my audience, that it takes hardly 2 to 3 minutes. It's not painful at all. It is your comfort level with the gynecologist, and you can actually save yourself and prevent you happening from cervical cancer. Do not wait. Do not do self-treatments. What we have seen is a lot of information, and the denial is still there with a lot of young women, where they feel that anything and everything should be planned after 40. In this case, it is not the same way. So it's a request and an advice for everyone that it's just a test for 2 to 3 minutes. Now, I'll just, I have, in between, I'll take one question also. Dr. Rafia has asked age for screening. So I believe we have already completed this thing. So age for screening, Dr. Varsha, if you can quickly recap the
21
age
to
for
25.
screening.
We can start at 25 also, but it can be early depending upon the patient's history.
Absolutely. I'll ask Dr. Heldy this question. Is diabetes a risk factor for cervical cancer?
If your diabetes is, if the blood sugar is not controlled, it may decrease your immune system, and in decreased immune system you might develop cancer, any cancer.
Yeah, any cancer, and actually diabetes
is not a risk factor
Not a risk
for cervical cancer. It's not a risk factor for cervical cancer.
Yeah, it's not a direct risk for cervical cancer, but as Dr. Heldy correctly said, it can reduce the immunity, and that gives the chances of causing other cancers. So let us complete the whole journey, doctor. Now I'll ask Dr. Heldy. So once the report is completed, and either we find normal, and we will obviously guide the patient to come next year, 2 years, or 3 years as per the report, and we'll also advise her how to take care of hygiene and other things so that she's rest assured. In case the report is abnormal, what will be their mention on the report, and how do you have to tackle it politely with the patient? What is the next step for her to do?
Okay, so explain to her the condition first, and then we'll have to monitor more frequently than the usual. Okay, than usual. We have mentioned a while ago the schedule for monitoring with those with normal results. So we'll have to do it. We'll explain to her because there are several abnormal findings in a pap smear. So if there is unclear or abnormal or unsatisfactory results, that's when we advise the patients to come more often for regular follow-up.
Thank you, doctor. So, Dr. Varsha, so is there any procedure to be done also to verify the HPV infection, like anything to do with colposcopy or any other procedure people should know?
The infection we can detect with the same sample which we have taken for the pap smear, and once we get the result, either it's a normal pap smear result or it is abnormal. Now, abnormality can vary. It can be labeled as ASCUS. ASCUS is when they label it as atypical cells of undetermined significance. It can be a low-grade lesion, which would be CIN1. It can be a moderate lesion, CIN2. It can be a severe lesion, CIN3. Now, depending on the abnormality, we will refer the patient to the colposcopy clinic. The colposcopy, if the results are abnormal, it should be done as early as possible without wasting any time. In colposcopy, what we are doing is, we have a colposcope. We are able to actually see the cervix in a magnified view. We are able to visualize the magnified view of the cervix. After seeing the cervix, we apply some dilute acetic acid to the cervix, which will, if there is any abnormal cell, if the cervix appears to be abnormal, the dilute acetic acid will turn that cervix white. We are able to see a white lesion. We then take multiple punch biopsies from the cervix and send the tissue for examination, for pathological examination, the results of which we expect in another 1 week's time. Sometimes when the cervix is grossly abnormal, when we are, it looks highly suspicious, then I would like to add that even pap smears might come negative. For a gross cervical lesion, for a cancer, also the pap smear can come negative. So whenever you're finding any suspicious lesion, we don't leave it like that. You should always take a biopsy from that, irrespective of what is the report of the pap smear, whether it is normal or abnormal.
So actually, expertise matters here a lot. So it is only your gynecologist who can tell you about your health. Irrespective, we don't really trust completely on the reports. It is something which is clinical expertise. For that, people need to see their gynecologist, trust in them, and rely on them. And sometimes, people, a lot of people have questions that my Pap test was negative or normal. Still, my doctor is asking for a lot of other tests. So please do not carry such kind of thinking in your mind. It is only for your health. And let this be decided by your treating gynecologist. Yes, Dr. Varsha, please.
So again, Dr. Asya, colposcopy is not a very difficult procedure. It's not so painful. Most of the times, it is done in our OPD clinic. Patients are able to bear with it and some discomfort, but it's very important to do the procedure. Now, depending upon the colposcopy report, you go ahead with the treatment. The colposcopy report again can be normal, it can be abnormal. In abnormal report,
absolutely, doctor, because then we are taking biopsy, so if it is the final one. So I have just one question from Mr. Hafiz Wani. How do you associate sexual activity at early age before 16 with cervical epithelial changes? Dr. Varsha, I would like you to answer this question. Probably Mr. Wani is asking if the woman is unmarried and still we are thinking of 16-year age. So do we have any specific answer for him?
It's very common these days, as we all know that we are seeing patients here from different cultures, from different societies. They have their different values. So early sexual intercourse before 16 is also common. The only thing is we need to educate our children about the sex education is very important. They should know that use of condoms prevents them from cervical cancers as well as from HPV infections and various other sexually transmitted diseases. One more thing, we should promote at this time. I would like to talk about the vaccination for cervical cancer. Because intercourse, early sexual activity is very common. So giving vaccine for HPV, we all know that HPV is one of the most common cause of cervical cancers. More than 99.5% of cervical cancers are related to infection with the HPV virus. Among HPV virus also, there are some high-risk type. Among the high-risk type 16 and 18, is responsible for almost 80% of cervical malignancies, and rest of the high-risk HPVs are responsible for rest of the 15 to 20% of the cases. So we have vaccines which are available which protect against type 16 and 18. The ideal age to give these vaccines is before the girls or the boys they become sexually active. The ideal age is from 11 to 15. It can be extended to the age of 18 to 25 also. So
Absolutely, doctor. Thank you. So, Dr. Healthy, I just want to ask, is there any provision for HPV to be done through blood sampling?
For now, we don't have any researches or studies about that yet. Let me just add about the vaccination. It can be started also as early as 9 years old. And this is advisable because of the pre-exposure of the children before sexual intercourse. Okay, and if the children are the doses for the vaccination, it is usually given for 2 doses, whereas with adults, it is usually given in 3 doses.
Yeah, for everyone to know that this vaccine is available at Prime Health, and we have an ongoing promotion also going on, and we have also a lot of health packages related to cervical. So this is important because we make sure that we encourage all of you to increase your awareness and must know that this is very important as early as possible. Vaccination, as both the doctors confirmed that 9 onwards we should do. So, doctor, should boys also go for cervical vaccination? Is a big question.
As per latest guidelines, Dr. Asia, in 2008, they had introduced the cervical cancer vaccine only for girls. But in 2019, they have introduced it for boys also. There's no harm in boys also taking the vaccine because at the end, it's a sexually transmitted disease, which
They
is
are the one who are giving, who may be also responsible for giving
and
the infection.
I have given it to both my kids, my son and my daughter. So I would promote that it should be given to both boys and
I'm
girls.
sure after COVID, we are very kind to vaccination process now. Earlier, it used to be really difficult, but the important thing is to at least be aware. Then, whether people want to take it or don't want to take it, it is definitely their decision. As a healthcare provider, we are here to tell you it is important. Please take care of your kids at the right appropriate age. If we can really reduce the occurrence of the second highest cancer in the world, why not to prevent it with early vaccination? Dr. Varsha, was there any chance you could promote it in schools or colleges, or probably schools is the ideal age for this? So is there any incidents such happened? How was the reaction of the school? How is the reaction of the parents when we tell them that we should go for cervical vaccination early for their children?
Actually, the awareness is increasing these days. We see parents who come on their own also and ask for the vaccine for their children. So the it is increasing, but we need to promote more and more. We need to create the awareness in schools more and more. That has to be a step forward from our side also as healthcare professionals. But the awareness is definitely increasing.
Yeah.
Cost also might be a factor. These vaccines are very costly. They are not covered by insurance. The Gardasil 9 vaccine, which is available with us, it costs around 700 dirham for one vial. And you have to give it in three doses in the first month, second month, and sixth month. So cost also could be one factor. But
But when it comes to lives, I don't think cost should be a factor, because we are anyways reducing the occurrence of the disease, which is definitely a very high cost
disease is more costly as compared to the vaccine.
Yes,
vaccine.
and if properly explain to the patients the benefits of having the vaccination, if they understood it well, they'll probably go for the vaccination.
Doctor, we have a question from Dr. Payal. HPV PCR include which type of HPV high risks? I couldn't understand this question properly. If you can, please comment on the same.
Dr. Payal is a microbiologist. So high risk HPV is we have HPV infections can be low risk and high risk. There are different type of HPVs. There are almost 50 type of HPV viruses. Out of them, the high risk, it's important to do the HR-HPV. That is the high risk only, because completing the low risk also is adding unnecessary financial burden also, probably. So HR-HPV includes type 16, 18, 52, 53, 31. So there are almost 19 to 20 types of high risk HPV, which is covered when you're doing HR-HPV PCR.
Thank you, Doctor. Before the webinar, we always have this habit of sending the information across to the group. I have some questions to ask you. I think we have covered most of them, but still, I would like to mention their names. Miss Treya is asking, is it safe even we don't do cervical vaccine? Maybe we can take this quick round of questions. Dr. Varsha, Miss Treya is asking, is it safe even if we don't do cervical vaccine? So probably she's asking simply, is it safe not to do vaccine?
You cannot say, as we said, that the type 16 and 18 is most virulent and responsible for most of the cervical cancers, and the vaccine provides protection against these. So it's good to take.
It's good to take, definitely. Miss Mariam Ahmed is asking Dr. Hildy, what are the symptoms for cervical cancer? Let's give it a quick shot for them. So I think we have already mentioned, but I'll request you a quick one again.
So first is the unusual vaginal discharge, which we have to investigate through the screening pap test. And of course, the unexplained bleeding, postcoital or menopausal bleeding, abdominal bloating, unexplained weight loss, and that's it.
Very important question. Miss Minute is asking, how many percent chances for a woman have a cervical cancer, considering either one of paternal or maternal side have had history of it? So probably cervical cancer history from either side. What is the chances of getting this cervical cancer in your lifetime?
It's very low. It's mainly the disease is related to personal environmental factors. It's more of an environmental disease rather than a genetic disease. But if you have a first degree relative who is affected with cervical cancer, they were saying that the risk increases to around twofold or something. But I'm not sure about the exact percentage. It's not too high. Mainly the environment plays more definite role in cervical cancer.
Thank you, Doctor. Dr. Heldy, Ms. Saida is asking, at what time do we need to check for it? We have answered it, but quickly, I think you already mentioned at least after 21 if a person is sexually active, right?
Yes. Without respect to the sexual intercourse or the beginning of sexual intercourse, so as early as 21 years old, we can have a screening already, not just pap test and HPV test.
Very good question. Mr. Muhammad is asking, how is HPV treated during pregnancy? Yeah, I think it's very important to ask. So, suppose a person.
Treatment for HPV. If you find abnormal cells, if there is CIN1, CIN2, CIN3 in the pap smears during pregnancy, there are certain changes in the cervical cells. The cytology is different. So the examination is very important, and it might be the pathology might vary during pregnancy and in a non-pregnant female. But if there is cervical cancer during pregnancy, depending upon the stage, it has to be treated. And if it is a low-grade lesion, it can wait till the patient completes the pregnancy after 9 months are over after delivery, and then you can repeat. So it's a long chapter actually.
But long chapter, but it is possible to treat. We have treated.
Depending upon how severe it is and whether it actually needs a treatment.
So in that case, doctor, when a woman is pregnant, we are not supposed to do the pap smear, but maybe woman has never done the pap smear before. So how do we proceed with it then? Like woman at 45, first time pregnant and never done cervical check before. Is there any particular recommendation for them?
The recommendation is routine recalls only. Irrespective of whether there is pregnancy or non-pregnancy, every woman should get the tests done every 3 years or every 5 years, depending upon their age. It doesn't change with pregnancy. But yes, if someone has had some abnormal cells, then yes, you can do a colposcopy also during pregnancy, but in the second trimester. If there is any abnormal cell, if it is a high-grade lesion, anything unusual, or if sometimes patients can have cervical cancers also detected during pregnancy. So depending upon the stage of pregnancy and the stage of disease, it has to be treated. You have to make the balance between the two.
Absolutely, we have to obviously analyze the risk and benefit ratio and proceed accordingly. So Dr. Heldy, Mr. Vani is again asking correlation of HIV and HPV.
So HIV is another condition that decreases the immune system, okay? So it makes it hard for your body to fight off health problems such as cancer.
So yeah, immunocompromised will also give the chance to any other infection to grow, or even for that matter, any chronic disease will come a little bit. Okay, we are receiving a lot of thank you, nice information, and best notes for the speakers. Just I'm putting that on the screen. There's one question again from Mr. Vani. Maybe Dr. Varsha can answer this. How are you managing pre-cervical cancer patients?
We just spoke about it. Yeah, pre-cervical cancer means it is not the invasive cancer. but the patient needs treatment. The patient needs treatment depending upon the colposcopic biopsy findings, whether it is CIN1, CIN2, or CIN3. CIN1 is a low-grade lesion which can be followed up with the HR-HPV and the pap smears. The risk of progression into cervical cancer is very low with CIN1. But if it is a moderate or a high grade lesion like CIN2 or CIN3, it definitely needs a treatment. The treatment is called LEDS. It's the loop excision of the transformation zone. The cervix is there, and a part of the cervix, a cone of the cervix, is removed. This procedure is done under anesthesia, and with this procedure, a part of the cervix, the cone is gone. So there is increased chance, we have to explain to the patient that there is an increased chance for her to have obstetric complications like preterm labor, preterm delivery. But this treatment is very important. And once we remove that cone of tissue, it is sent for biopsy, and we have to rule out any kind of extension into the cervix beyond that. In case it is there, then it is treated as an invasive cancer and it has to be managed according to the guidelines.
As we are proceeding towards the end of session, it's important from both my speakers, and I'll request specifically with Dr. Healthy to speak in Tagalog language. Take-home message, like how do you want your patients, to get benefit out of any awareness program, what they should do, a brief message for, people to understand in your language. So I'll start with Dr. Healthy first.
Okay. Mga kabayan, importante na magpa-screen tayo ng maaga, like yung sa pap smear, and get vaccinated also. So may mga survivors na nagsabi na early screening and vaccination change your life. So these are the importance of early screening because it can prevent, maiwasan yung pag-transform sa cervical cancer, and you can take control of your life.
And Dr. Healthy, where they can book an appointment if they would like to visit you?
Yes, so I'm scheduled every day here in Prime Health Medical Center in Sheikh Zayed branch. I'm here every day from Monday to Sunday, except Friday, of course, 9 to 1 and 5 to 9 a day.
Thank you. Dr. Varsha, thank you so much. I think we all have a very good, information, specifically me. I got to learn a lot of new information and information which is important for my patients as a general practitioner, and definitely looking forward to more of these sessions. But I will want you to, give take a home message for all the women so that they can really take care of their lives.
Thank you so much, Dr. Asya. It's my pleasure also always to speak about women's health. This is the topic which is dearest to all of us. The most important message I would like to tell to all my patients is don't be in the denial mode. Don't ignore your health. Take care of your health. Go ahead, do your regular self-examinations. Best what birthday gift also you can give to yourself is go and pamper yourself along with the spa. Come to the doctor, get your routine examinations done so that any disease, if it's there, it is picked up on time. Anything which is picked up on time, it can be treated well. Even for breast cancer, even for cervical cancers, if they are detected at an early stage, you can avoid major surgeries, you can avoid chemotherapies, you can avoid radiotherapies, and you can have a good quality of life. So early detection, early screening, and timely treatment is very important.
Thank you, Dr. Varsha. Thank you, Dr. Healthy. It was, as I say, that very great session. And with all these kind of information, with all these kind of sessions, we can end cervical cancer. So the theme for this year is get informed, find out the facts about cervical cancer and the human papilloma virus that causes it. Help educate other women in your life too about this deadly disease. Get screened cervical cancer screening typically starts 30, but what we discussed today, 21 is not a bad idea to also start with. If you're still confused, then probably you can always speak with your gynecologist. Gynecologist is the first person who holds you when you are born, so you can always visit her for your queries. And most importantly, get vaccinated. The HPV vaccine is given in 2 or 3 doses and should start at 9 for females, and HPV vaccine is also available for boys. For that also you need to discuss with the gynecologist to give you more details. For me, information to tell all of you is that do not forget that more than 95% of cervical cancer is due to the human papillomavirus, and also known as HPV. With that message, we all will hope that you will stay healthy and stay better for life, inshallah. Thank you.
Thank you.
Thank you.